No medicine can remove the cause of a lifestyle disease, but you can. Welcome to this 5-part series on lifestyle diseases, before and after series. This time we are dealing with the angiogram and the treatments related to it, which are normally done later, including correction of lifestyle for improving heart health and avoiding future procedures. We have with us Dr. Jolly Thomson, who has extensive experience in treating lifestyle diseases, and heart disease and heart related problems are one of the key areas. The difference is she focuses on how to avoid surgery and other procedures by correcting lifestyle so that medications also can be reduced over time. Welcome, Dr. Jolly. The first question is, what is actually lifestyle correction and what is the difference with clinically supported lifestyle correction?
See, lifestyle correction, when we think about the lifestyle disease, heart attack, diabetes, hypertension, all comes under lifestyle diseases. But basically, lifestyle correction, everyone talk. But till now, there is not much of the efforts was taken on clinically supported lifestyle correction. So monitoring the patient with the clinical support and the clear guidance, that is actually was missing till now. So where my effort is mainly on give a correct guidance and support for the lifestyle correction and see what are the results and how the heart or how the blocked vessels are clearing up. So generally people have people is the current scenario. The heart attack means immediate angiography, stenting, or if it is not able to put a stent, go for the bypass surgery and go continue the medication lifelong. That is the norm or the current. So if you want to understand, if every heart patient or everyone who is worrying about heart disease or who is already on medication with the heart problems, listen throughout the video, then only you will be able to understand. So otherwise, it is very difficult because the current norm is going for the angioplasty and bypass. That is the current norm and continue the lifelong medication. I'm telling you how you can not only avoid bypass surgery or doing an angiography or even doing an angioplasty, or even to come out of medication. For the current patients, generally they use the medication. What medication which is actually given? It is only the medication for the cholesterol, blood thinners, and the diabetes. For the causative reason is actually diabetes and hypertension, and medication for controlling the hypertension and diabetes. That is the usual norm of the patient, and most of the patients will be having many other diseases also along with that, other than this diabetes, hypertension, dyslipidemia, that is cholesterol. So listen carefully and see. You should think yourself, why I am taking all these medicines, why I am going for the surgery, what is the benefit I am getting out of this undergoing this major surgery like bypass, and what are the disadvantages of this, and what is the problem with the fear, what are the negative factors or the side effects of putting a stent. So each patient should understand these aspects also, because understanding the about the disease and also the treatment is necessary for the current scenario of protecting your health. Well, you have asked about the difference between the lifestyle correction and the clinically supported lifestyle correction. The difference between is clearly, if usually the cardiologist will say you should reduce on calorie, control your blood sugar, and take medicines correctly. That is the usual advice given, and you may be getting a prescription from a dietitian about two slices of bread or 2 chapatis and this much portion advice and all. But in the clinically supported lifestyle correction, we go into the root cause of why this what is actually heart block, is the accumulation of fat and sometimes the calcification of the plaques, that is the fat depositing in your blood vessels internally, just like it can be considered as a pimples on the bump on the your skin with the pimples. Just like it is inside the blood vessel, it is happening. It is no more in a smaller sizes may be small because it is the small organ. So that is the only difference. It is actually when you get a heart attack, when this pimples rupture, There may be hard pimples that is not showing any oozing out tendency or breaking. So that they are much more stable. So it just like that, this pimples inside the blood vessels also, it can be, it's small, can be creating problem. Usually stent is applied when it is more than 70% or 80% block. But usually the block, the 80% of the attack is coming because of the rupture of these small pimples inside the blood vessel and forming a clot around that. So here in the clinically supported lifestyle correction, what we are doing is to clear these pimples inside the blood vessel, or this clear these fat deposits inside the blood vessels and making it stable, just by reducing the inflammation. The food has to be changed. And also, why this blood vessel problem is happening, why these your blood vessels are getting damaged, it is because of the excess glucose and the triglycerides. There is a fat running through your blood. It is actually the excess fat and the glucose inside your blood is creating this problem. So we have to correct that first. So that is our focus. Actually, in clinically supported lifestyle correction, it is indirectly to correct the heart or the blood vessel, removing the block. We correct the blood itself, the values inside the blood itself.
So it is very interesting from what you said, that the person who has a heart problem should do his best to understand what was it that caused his problem. So it is very easy for anyone to say, that just like anyone else, I also have gone fat, or have got BP or diabetes, and then I got an attack, and that's it. And unfortunately, most people never try to find out what went wrong, and why they got an attack. They are more concerned about, if they have had an attack, they are more concerned about how to get it fixed. Of course, fixing is one thing, and prevention of another attack is a totally different thing. So doctor's view is that, if you want a fixing of an attack, then you have to look at it at one way, like, you need a procedure or a stent or whatever it is. But if you want to prevent another attack, then you have to learn how to do it. No one else can give it to you in the form of a pill or a procedure. This is what I think you have meant. So the next question is, see, there are especially in our state of Kerala, there is a lot of developments in the health field in terms of new hospitals and large centers of excellence and all that. So what is it that these patients should know is the difference between centers of excellence and clinically supported lifestyle correction?
See, center of excellence for any disease, not only for the heart, that is a place where you can reverse the problem. It is not fixing. So for a patient, for a heart patient, once an attack has occurred, or in the family there is a history of heart attack, and when they took a health checkup, this TMG is positive, or the patient is having diabetes and the family history of heart disease or hypertension is there. If you can say, it's in the correct sense, a center of excellence is a place where the patient can be free of the disease and free of medication. If you are taking, you cannot call a diabetology clinic where it is treating with insulin for a type 2 patient or medication. It cannot be taken as a center of excellence at all, because you are not getting disease free. If you are putting a stent or a bypass surgery, or the center of excellence in the modern medical field, it is center of excellence by its equipments, basically. So if the patient, if there is bypass surgery, cardiac open heart surgery facility is there, it is called. And then the next level, if it's a cath lab level, if they have latest lasers to describe this atherosclerotic plaque, it is called a center of excellence. So all the center of excellence in the general term, it is the more and more sophisticated equipments are available. Medicines is always available for everyone. But for the centers, because it is very costly equipment, so it will be there only in the few hospitals. But in our part of where I am practicing, when I started practicing, there was no centers in 19 actually, and I came to the medical profession in 1981 and completed by after almost 8 to 10 years of uh, uh, this training is there. No? So only even after 10 years, there was no bypass surgery or stent. This stent application was taking place. But for the last 30 years, there are in most of the even each state, each district is having hospitals with the center of excellence, like all the cardiac facilities. In my city, in Kochi, it's a small city actually. Here itself is, I think, 4 or 5, maybe more than that. Many hospitals which have this so-called center of excellent facilities are available with all these serotractors and bypass surgery. All is available. But we should understand that if we can really be a center of excellence, we can reverse the condition and you can avoid the bypass surgery or a stenting. That is possible with this clinically supported lifestyle correction. That is the advantage of, that is the importance, because it is a new stream or new development. Many are not aware of it. That is why we are actually, I'm interested in describing with this interviews and all. I'm interested to more and more people aware of it. Then only you will be able to come out of it. Even for example, I can tell you that one of my classmates recently passed away. And when we have a meeting for his, after that, and one of the classmate, he's also a cardiologist, and he's telling that he had undergone two bypass surgery. And 2 or 3 times he had already put stent or had put a stent, but undergone two surgeries. And he was diabetic, hypertensive, and all, and obesity also is there, and passed away. Even after two bypass surgery and many stent applications, he got a heart attack and passed away. So the people should understand that it is not the answer is that not you got the problem not because of the lack of bypass surgery or a stent or multiple stent or nothing. It is the reason is your lifestyle problem and your high triglycerides in your blood, high blood glucose in your blood, and it is making your blood vessels stiff and making the heart work more because the dilatability of the blood vessel is lacking because of the damage created by the toxins. That is, glucose is the basic toxin, and the triglyceride you're eating excess. So that has to be corrected, and along with that, so many nutritional deficiencies also. So that has to be corrected. And if you are really focused on the correct scientific nature, or you understanding the science of the human body and try to correct it, that is the answer for that. That is simple. It will actually be simple, and you need not go for a, unless it is an emergency or a clot is there immediate, you need definitely care in the ICU, and you have to stabilize your heart and the blood, all the parameters. Then definitely the next step is correcting the lifestyle and do it in the proper manner.
Actually, what we understand is that, in case you have an emergency situation, these centers of excellence are really useful. But to prevent a second occurrence, there is nothing that is more important than what you do for yourself. That is how you correct yourself and see that a second recurrence is prevented. From what doctor often says regarding heart attack, that either a person is having a heart attack or he is creating conditions for a heart attack, or he is creating conditions to reverse an heart attack. And to make it more simpler for our viewers, you often say that if you are going to a medical facility, the primary situation, that is, if you are having a heart attack, is to get over that. But otherwise, the most important thing that you should be doing is reversing the conditions for the next attack. So in this context, what is it that you would like the patients to know? Because they may have already suffered an attack, but then regarding the future, also regarding stent and bypass, having multiple blocks, the normal understanding is you put one stent now or two stents now, and after some time, if things go worse, you can put another one or two stents or more, or whatever it is. Similarly, for bypass also, they say that you can do the bypass now, at a planned bypass, because bypass is never usually an emergency, but a bypass now, and if things don't go well after some time, you can do another bypass. So this option is always available for more stents and more bypasses, because we have very good centers of excellence. But whether you require more stents or more bypasses, that is something that you can learn when you're, I think, hearing from what doctor is speaking about.
See, I have treated in all level of patients actually, like those who are having little diabetes or hypertension and cholesterol or the triglyceride is high, and on medication or without even starting that, because of the family history, father had an attack or something like that, or the brother had a recent attack and passed away. They come for the treatment without going before an attack. And some others are coming after going for a health checkup. They done a TMG, that is the usual thing doctors check. And in that there is some exercise intolerance is there, or TMT was positive, and go ask for a CT angiography or an angiography itself. And they found that in CT angiography or a calcium score scan, so much of deposit of calcium is there, or in the CT there is angiogram, there is a block, or in the PCI, that is the golden standard, doing it directly, putting a stent and injecting dye and seeing that block is there. Or usually while doing the block, they'll try for putting the stent also, the interventional cardiologist. And they tried for the stent but not able to put the stent, or the position of the block is not in a favorable position to put a stent, then they will ask for a bypass surgery. These sort of different stages the patient come, and also they have undergone once or twice the bypass surgery and done stent already, and now there is nothing can be done. The cardiac function is very low and the output is low, only 27% is there. Now there is nothing can be done, only for going for a heart transplant. Heart transplant, it is not easy, no. So there are so many patients who are having this pumping is reduced, and but there is nothing can be done. I'm waiting for the or usually doctors, it is not available though. So the heart is not available for that. It is not no one can donate, a living person cannot donate a heart. So the kidney you can donate, but the liver, part of the liver can be donated. But the heart you cannot, only for the cadaveric or the dead person it is, or the dead person also it is not fit for. Only the brain death patients, the accident and all, brain death patients. So it is very rare for a transplant. But I had treated such patients also. It was only 27% or 25%. So if the patient is willing for the correction and taking the correct nutrition in the correct format with correct exercise, that if the cardiac patient cannot do much vigorous exercise or anything, gentle exercise, especially I'm giving it in the lying down position. It's not in lying or sitting position, not even standing. So a person who can walk can definitely do those exercises. And that is the pattern. And everyone, then initially they'll be very worried or fear, if I do this. But gradually they'll come up. And you can see the difference also. It is not blindly we are doing. When we are starting the patient, we'll be checking all the parameters and all the cardiac markers like troponin, HSCRP, homocysteine, of course, this lipid profile, and even the advanced lipid profile parameters like lipo-A and things. And we follow the patient, what is the difference also. And also this with the ultrasound scan itself, we can see how much of fat deposit is there, especially in the neck vessels and the peripheral arteries in the neck vessels, and also the leg. So we can see the opening of the blood vessels itself. Many of the cardiac patients will be having some atherosclerosis of the leg also. They will be having pain and all, especially those who are already had undergone some bypass surgery and all. Their blood vessel also must have been taken from there. And so the pain, leg pain after walking, they have that half pain also. So such patients also can be corrected, and you can see only if you believe, only when you're experienced. The CAP patients, many, and also I'm seeing many comments below the video also. How is it possible? Is it possible? It is possible. Only thing you have to understand it and go accordingly. And for to treat the patient also, I should have a very good thorough knowledge about the patient's current body parameters, the organ status, not only about the heart, the kidney, liver, everything you have to know, and also the patient's lifestyle, and also food habits, and correct accordingly. So it is difficult, but it is when it is put it in a protocol and it is applied in the correct way, it is very simple. But it has to have certain. The patient also should understand that for the bypass surgery, patient has nothing to do. The insurance will pay generally for the cost, and also patient has to only undergo this surgery, and the pain, you have to suffer the pain and the discomforts, that's all. But here it is entirely different. You have to understand the what is wrong with your lifestyle and should be willing for the correction. That is the only thing. So if you are able to willing for that, the correction is very simple, and you can see the result also changing. Not only you are avoiding a surgery or the cardiological interventions, you can come out of the medication also. Otherwise, you have to continue all your medication for the diabetes, hypertension, and all. Usually, my patients will come out of all the medications for the diabetes, hypertension, dyslipidemia, all within a month itself. And it has to be simply you cannot. Just we are not stopping or tapering of the medicines just like that. It's all with each every week we will be checking and accordingly. And then after it is corrected and stopped the medicine also, we will be continuing checking till at least 3 to 6 months follow-up is there, and that is sufficient. And the patient will, by the time patient will learn.
Actually, from what you have mentioned, basically the patient has a very major role in preventing another heart attack, even though they have done stent or bypass and all that. But at the same time, you also often say that stenting. Many people, many patients think that putting a stent is primarily for preventing heart attacks. But if you look at it carefully, stenting has a very small role in preventing heart attacks, and also it is said that almost all heart attacks happen where blockage is less than 50%, while stent is put when the blockage is more than 75% or 85% and all that. So what should patients understand about this angina and prevention of another attack?
Angina is actually the pain when the heart is not getting enough blood circulation. Just like when if you're having this atherosclerosis of the leg, if you walk for a thing, you get the leg will start paining. Just like the heart is pumping for, if you want to walk, the heart has to pump. If when you eat to digest the food, heart has to work. So when the heart is not able to, or when you are stressed, you need more blood. For more activities are the pumping will be, the heartbeat will be go up, and then the heart will find it difficult to, the muscle will not get, then you feel the pain there. If the heart is not, heart blood vessels are not giving enough blood, circulation, blood to the nutrient, to the cardiac muscles, then the pain is felt, and it can be referred to your shoulder or your cheek or your jaws, or to even to the left hand, you feel the pain. So that can be stable angina or unstable angina. Unstable angina, it is actually, there is not only, if you do a angiogram or angioplasty or bypass surgery, only you are opening up one block, major block. But if the block, then if the patient is very severe angina and all, they will get a relief for the time being, for a short time. But the problem is why these patients, the latest study shows that if you put a stent, or you have undergone a bypass surgery, or you are only on taking medicine, the repeat attack possibility and death because of a second attack is the same, or the life expectancy is same for all these three groups. Because as you said, it is not the major 80% blocks is creating the sudden attacks and death. And actually this 80% or 90% or 100% block also is there. Then the body is able to get time to circumvent the problem by making more new blood vessels to supply the heart. That is the reason that many people who is having 100% or 90% block also still alive. The death is happening because of this plaque rupture. That is happening in this 40%, 50%. And the studies also shows that 80% of the rupture is happening because of the, or more than 80% is happening, it's not in small, less than 50% blocks. So that is actually, that you can get at any time if you are doing a vigorous exercise. Like when you are doing an activity in the gym, where youngsters doing physical activity and exerting, it can stimulate the rupture of the thing. And also, if you are doing it a stressful situation, there may be someone maybe speaking in the public speech, or when you are hearing a bad news of a close one's death. So then you can get the attack. That is because that time that plaque can be, because the heart is beating higher, and because of the multiple factors, that plaque can rupture and a clot can form, and the blood vessel, even the 50% blood vessel is blocked, only block is there, 50% the flow is there. But because of the sudden bursting of this fat molecule or the pimple inside the blood vessel, and the clotting mechanism is activated, and the blood vessels, the small blood vessel is totally blocked. That is the place where you get an attack. So prevent that, you have to correct your lifestyle, you have to correct your glucose count, you have to correct your insulin level itself. Actually, insulin these type 2 diabetes patients are generally hyperinsulinemic, especially when they take after postprandial, the insulin level will go high. That is actually creating problem. So we had to come to the root cause. See, only in the cardiology point of this putting the stent and doing the bypass is only superficial thing. You have to come to the root cause and correct the root cause, which is creating all this problem. So, if the patient is able to understand the root cause and how to correct it, only you can escape from the second attack. That everyone should understand. So that is why I'm telling everyone to clear this whole. This actually it's a 5-session video, and you have to start from the reason, then the latest treatment methods, then to the comorbidities associated, that is the other diseases which is the creating this heart problem or damaging your blood vessel, and then what is the role of clinically supported lifestyle correction, and also we'll be discussing the results also. So you can go. Then you will, if you are patient enough, you will understand what is it, and then you can make the decision.
Actually, from this, we understand that when a patient is informed after an angiogram that they have blocks of certain types and all that, and multiple blocks or so, and there is a need for a stent because the blocking is relatively high, or from other tests they also know that they require a bypass and all that. Normally, all these patients, they will be focusing on their heart issue because that is the life and death matter for them. So in this circumstance, what is it that you would like to let the patients know? Because you always say heart attack is usually most often caused by other lifestyle diseases. So if other lifestyle diseases are so important in causing these attacks, what should patients know when they get treated? Because normally, once they hear this issue of their heart, they will forget everything else.
Basically, everyone should simply logically think over. There are people, many of the people are advised for the bypass surgery or advised to stent or angiography. They're not doing it, and they do the lifestyle correction, and they're living a long life itself. I'm seeing so many patients like that. They have been advised, but they have not decided. They are gone for the lifestyle correction. And other type of patients who's undergoing the surgery, bypass surgery, or the putting stent, and they are getting the repeat attacks, and dying also because of the repeat attack. So what is the difference? And then there are people otherwise also they are put a stent or bypass surgery, but they are also living a long life. After 10 years, 15 years, they are living. Those who are doing the correction of the lifestyle, they are getting a long life. That is, so medical field also it is accepted fact that it's the many studies are there. So most important is the lifestyle correction. And many people who is taking all this aspirin and clopidogrel and so many medication for the heart, they won't be, and the diabetic medicines, they won't be able to do the lifestyle correction in the proper manner, because they'll be having so much of stomach problem. If you and also the insulin hyperinsulinemia and hypoinsulinemia. When you take insulin, it goes hypoinsulinemia, and after you when you eat food, it will go to hyperinsulinemia. So both is actually damaging, and both this actually, when in between, you will not be able to, the patient will not be able to do the lifestyle correction or the food control, in the proper manner, and they'll be always tired. The patient who's taking BP medicines and all these medicines, they'll be always feeling tired. That is, I'm always seeing patients who are very tired and not able to do anything. So they are not in a fit position to do the exercises also. Or that is the reason for it is this problem is continuing, and you are on lifelong medicine, and lifelong will not be able to do the corrections. So here the correct lifestyle correction itself will be able to make you free from medication. That is the most important thing we are doing. It make you free from the medication, and now it is possible. With this, what I'm doing, I'm doing it with a clear protocol, that is cell activation protocol with a special CAP diet. That is, we call it as CAP, and the diet was specifically called it as a CAP diet. And also the exercise, we call it oxyflex exercise actually. With that, we can come out of and all the medicines. And if you have diabetes and hypertension also, you can be cleared. So that is the important. And only thing, it is the people may not be able to believe it when you are hearing it. That is why I am asking the people who's in looking for the solution for the heart disease or diabetes or hypertension, or looking for prevention of another attack, go through the videos. There are so many videos on this heart attack, and also the mechanisms describing this, how this repair of the activity and how the immune system is acting on this, how the immune system is helping. Actually, you should confidence in having your own immune system. That is the repair mechanisms. The blood, the clot, this fat deposited in your arteries can be cleared by no one else. The laser or has only very minor part. But your immune system has the capacity. So believe in your own immune system, your own healing power, and activate it, and go ahead with the correctly understanding to how to help your immune system. And then if it is not too delayed, it is you will be able to. So if you're one or two, if you are having heart problem along with the kidney failure, then it is difficult. More than one organ, two organ is failure, especially in the late stage of the failure, then you will not be able to. So act early. So if you are in the early heart problem, even if you have put a stent or bypass, it is okay. You can, there is, if you are able to walk at least slowly, then you are, and your kidney is okay, and you are not in the late renal failure like stage 5 renal failure and heart problem in the stage, then we will not be able to help you. But otherwise, if it is in early renal failure, also stage 2 or 3, it's okay. Along with the heart problem, you can come out of all the medication. Only in special circumstances like you put a stent within a year, then you have to continue this blood thinners to prevent the complications associated with this stent. If you come before the stent, putting the stent, or after, or after 1 year after the stent application, you can come out of all the medications within a month itself. That is what my experience. But it is the effort of the patient also, and the willingness and understanding of the patient also is very important.
Actually, from what we heard just now, basically what we understand is that the patient's understanding of what the treatment is doing for him or her is primary requirement for success. The patient should understand what a stent is doing for them, or what the bypass is doing for them. It is that fine understanding. It is not that I am getting an operation done and my health is getting okay. It is much more than that. You have to really understand what is the end result of such a procedure. Then only you will be able to compare it with what doctor was telling regarding clinically supported lifestyle correction, because then you will be able to judge for yourself what is the plus and minus of both the conditions and treatments. Now, you are often saying that creating health is the first step to reversing heart disease. Actually, when you mention creating health, you say that creating health is not like doing a surgery or doing a procedure or doing anything like that, but you have to create the health within the patient. So what is it that patients should understand when you are saying create health first, so that your disease can be reversed? Without creating health, your disease will never be reversed.
Create health means you should have an understanding, and you have a disease. So many of the cells are damaged. The heart patients, the blood vessels itself is damaged. When you talk about the heart, the blood vessels of the heart or the supplying the muscles of the heart is damaged. So not only the blood vessels of the heart is blood vessel actually is almost 6,500 kilometers, 65,000 kilometers. It's the length of the blood vessel. So not only the heart blood vessels, the whole body blood vessels will be affected. So your brain blood vessels will be affected, the kidney blood vessels will be affected, your liver blood vessels will be affected, and your leg blood vessels also will be affected. So many of the whole body is affected, not only the heart, but the heart is very important, because if the heart stops, your life is finished. So you had to repair your blood vessels, and for repairing that, you had to give enough nutrition. And the nutrition is used, actually it is the immune system which is the healer in you. The real doctor, whatever is done, whatever procedures is done, the real healer is your immune system. In the bypass surgery, you are making the cutting the chest bone and opening it and doing the surgery. And who is actually healing this wound? It is the immune system's effort, is the healing. So if you are cutting and opening the heart, and even the cardiac membrane, that is the pericardium, also is opened, and it can heal after this. If the sick person who's already heart and blood vessel is damaged, if after that this major surgery, the wound can be healed, then why not this your own immune system can remove these blocks? So you should think in that way. And if you have confidence in the immune system doesn't have anything else other than the nutrient. And also the toxins to be avoided. The excess toxin actually is making it inflammatory, and making this calcification and all is because of the inflammation. So the balance of the inflammation and the anti-inflammatory activity has to bring it. So all the medicines which is using in the current medical system is anti-inflammatory. One or other way, even the statin or the other medications, or one or other way, it is actually blocking the inflammation. So the medication which is blocking the inflammatory activity will block the healing system also. That is why the clinical is about a lifestyle correction. We try to come out of this all medications to promote the healing. You have to and support the anti-inflammatory activities of the immune system. So if you can do it in the correct way, the immune system will act for you. And the real doctor is within you, and believe in that doctor, your own immune system, and support the immune system with nutrition, avoid toxins, and improve the circulation by planned and segmented. When you're a heart patient, you cannot do all the activities, and you should very segmentally, part by part only, you can stimulate and do the exercise, and you will be able to clear your blood vessels from the blocks.
Actually, it is very interesting to understand that no one talks about the immune system and heart attacks together. Everyone is concerned about heart attacks as if it's a question of blocks created by high cholesterol, high triglyceride, and all that. But what doctor has very specifically shown is heart attacks are very much related to our immune system. The overactivity of immune system is creating actually a setup like plaque, and then the control of that activity prevents over inflammation and causing heart attacks. So from what doctor has said is very crucial for everyone to understand, that the immune system has a major role in heart attacks. So can you actually explain that this plaque formation is something like development of an immune response, and then control of that is controlling inflammation, is a basic necessity to prevent heart attacks. So what should patients really understand? Because everyone knows that the lifestyle has a lot to do with the immune system of the body, and no medicine, no procedures actually are able to directly influence the immune system as much as lifestyle. So what should patients know about their immune system and heart attacks?
we have medicines to influence the immune system. That is actually this blocking the immune system or suppressing the immune system. That is actually all the medicines. We know that at the end stage or when we are very seriously sick, we use steroids. That is the directly blocking all the inflammatory activity. Actually, medicines other than only medicine which is supporting the immune system is vaccines. So it is trying to in memory and all. Everyone knows that vaccines are actually increasing the immune activity or to prevent a disease or infection. It's only point of view of the infection, and also this antibiotics. Here also it helps immune system to fight the germs or the disease causing agents. So these two medicines, actually these vaccines and the antibiotic, that is actually was a boon for us, and it is actually this life expectancy has increased because of these two only. And also the painkillers, even the anesthetic medicines, that they are all actually this blocking the, it's a pain is the manifestation of the immune system, that is the defense system. Immune system has two wings, this defense and the healing. It is a manifestation of the defense system, and we are with very effective medicines, we are able to block the aspects. That is why we are able to do the surgery. If you know, we cannot, if we are conscious or we will be having pain, actually we are making it unconscious and removing this pain senses as such. That is why we are able to do the surgeries. It is very useful in the case of an accident and or wound to getting the stitch or getting operated. But it is most misused in this sort of lifestyle diseases. So we are going on, because you can put into anesthesia and you don't feel the pain, you are misusing the medicines actually. Maybe that the technology itself you are misusing too much. And also the diabetic medicines, actually this one of the major reason for this plaque deposition itself is hyperinsulinemia. And but the patient is already, I have seen many patients where insulin level is so high, 25 to 250 300 and all. They're taking every day one insulin jab also. So that insulin is actually promoting deposition of the fat inside the blood vessels. So many is not aware getting, because these all protocols are fixed for a long time, and this changes in the understanding of the lifestyle, this micro mechanism or the molecular mechanisms, no one is aware. Doctors is trained not in the molecular medicine or the molecular science of lifestyles. No one is training in terms of our training is basically how to use the available medicines, and that is the medical developers, the pharmaceutical companies who are the conducting the studies. They will be giving the guidance, and also this medical equipment manufacturers are making that, and they are understanding giving the studies, and according to their instructions the doctors are working. So there is so much of limitation in that. And understanding about, because of so much of specialization, the patient should understand that the limitations of the patients, the doctors, and also the hospital system, and also the pharma and the this equipment manufacturers, because they are working on the focus of that. But you should have a holistic view. You should the whole thing you should be able to. That is very difficult. I understand that with this busy life, a techie or a businessman will not be able to study all these things and make a decision by themselves. So they submit themselves to the professionals. But one thing one should understand, that no medicine can reverse. Till now, there is no one can claim also the medicine or the surgical procedures can cure you or reverse a disease. Unless the surgery can, if you have a fracture, it can be fixed with the surgery and all. Even though there will be limitations in that also, the final healing has to come from inside you. So empowering the immune system and understanding the immune system most important. And you had to understand that everyone knows that about the immune system and immunity and all. You had to understand the role of immune system in correcting the heart attack or the blood vessel block. You should understand that and empower your immune system to come out of that.
Actually, this is a very important thing to remember, that most people generally think high BP, that is high blood pressure, and diabetes are the primary causes of heart attack and all that. But the most important thing people generally don't realize, according to Dr. Jolly, is high insulin in their blood is a real danger to their heart. And high insulin is most likely in patients who are diabetic and even pre-diabetic, but most often in patients who are taking additional insulin injections as well. So this high insulin is a very big challenge to the heart and the vessels, the cardiac vessels and general blood vessels. And patients should realize that when we are considering heart attack, when we consider the solution as stent and bypass, we often forget how we should manage high insulin, high glucose, high BP, and others, because we are focusing on the heart itself. So, from what we have heard in this interview, I think it is possible for patients and the general public to understand that the solution to heart attacks is not limited to stents and bypass, but more importantly, to the understanding of what is causing it and what can prevent a future heart attack. With this, we come to the end of the fourth episode. In the next and final episode, we will be seeing examples of how, after an angiogram or when any problem with the heart has been revealed, how the successful treatment with the lifestyle correction using clinically supported lifestyle correction has been done with examples of patients. Thank you. The informed patient is key to treatment success.